ladies and gentlemen, especially my old friend, Dr. Manning. Dr. Manning. Okay, so Dr. Gross showed you what WHO is doing. Let me give you an example of what we are doing also in the Philippines. And let's go to the next slide. And I'll just show you an example of a hospital which has received a lot of damages during the typhoon in 2006. Although this is not the only hospital that were destroyed during the 2006 typhoon regime. I just would like to show what we did with this hospital. So as you notice, this Bicol Regional Teaching and Training Hospital is a 250-bed tertiary hospital located in Legazpi City and the province of Albay. And normally in the Philippines, we have around 21 to 22 typhoons a year hitting the Philippines, and 2 to 3 typhoons directly hits Albay, and mostly during the months of October, November, and December. And in addition, Bicol Regional is also just outside the 9-kilometer danger zone of the Mayon volcano, Legazpi City, which is bounded in the east by the Albay Gulf. And these are the service capability of the hospital: 250-bed capacity, catering to basically medicine, surgery, pediatric, and OBGYN clients. It's open, of course, 24 hours, daily manned by trained nurses and physicians with a regular schedule of personnel. And the maximum number of patients seen is 80 per day, and 30 of them are usually admitted. Next slide. It has a well-established networking and coordination system with the Department of Health Retained Hospitals, GOs, and NGOs, and with adequate communication facilities. Next slide. And on November 30, 2006, this is what is the status of patients in the hospital, with 225 patients admitted on that day. Next slide. So what happened on that day? The typhoon Berning hit the country, which is actually the fourth typhoon hitting Philippines around the same area, and it caused damage to roofs, windows, ceilings, floors to the hospital. You can see that on the slide. Next. And facilities and equipment were damaged. The X-ray was also damaged, including all the communication. Next slide. You can see the damaged records and documents, because it was actually the roof of the hospital was blown out, and basically it hit all the second floor of the hospital. Next slide. There were damaged lifelines. There was no water in the area. There was no electricity, communication, and then transportation. We have known that during that particular disaster, electricity was out in the whole of the Bicol region, and we cannot coordinate even by using the local phone or the cellular phones, because all the poles were down, including electricity poles were down. Next slide. The impact of the service delivery, the hospital operation stopped for a while and concentrated on emergency and semi-emergency cases only, and for typhoon victims. So basically, they were not doing any elective operation and elective admissions. Regular services were disrupted, and knowing that that hospital is the end referral hospital, since all other hospitals in the area were damaged, including the barangay health station, the rural health units. So basically, this is the tertiary hospital of the province. Next slide. So there was an overwhelming demand of the emergency room services. So all the patients are going to the hospital since the other district hospitals were damaged. Next slide. The influx of patients in the emergency room during that time was a big number, so that they don't know what to do. Next slide. There was also, because of the service delivery was hampered due to the limited use of facilities. As I mentioned, the X-rays were down. There was no generator. The emergency room cannot really fully function. Next slide. In addition, that initially transportation is disrupted, so that we cannot send at once the services being required. Waste management and ancillary diagnostic services were also disrupted. Next slide. Now, to the people, very important. DRRTH personnel are also victims of disaster. So basically, initially, only 50% of the people or the hospital staff reported to work. There were in addition, also the relatives and watchers are also victims, so they just got the adaptation. There were psychological trauma into most of the personnel in addition to the victims, and there was overworked staff. Next slide. There was also extended leave of absence of some personnel because they were caring for the affected families and destroyed properties. Actually, initially, we also received a lot of requests that we give support, not just to the victims, but also, of course, to our responders and to the hospital personnel. So what did the hospital do? What was the response of the hospital? There was a declaration of a code red. Now, in the Philippines, we have a policy that we follow. There is an alert system already passed as a policy by the department, which is actually not just being followed by government hospitals, but some private hospitals as well. When we talk of code red, this is the highest code. We talk from code white, then blue and red. This talks about the preparation of the personnel, what kind of logistics should be done, what kind of networking should be done, and basically when we talk of code red, automatically all personnel in the hospital should report. Whether they are technical staff or administrative staff, they should report. Now, this is very important because it provided a stance of readiness to all the hospital, so they would know what to do. The declaration of code red is also important because you also come up with your command system. Now, in this kind of disaster, what we fear at the time was the octopus effect, which is basically if you hit the head of the octopus, all the tentacles will not work anymore. So what we were thinking is that if the leadership of the hospital was hit, then how would the hospital run? But fortunately, at that time, that the hospital director was able to provide leadership. Some of these hospital leaders were not absent, were not present. So there was a shift to an emergency mode, which means that other personnel was given multitasking. So that is basically what we mean by declaration of a code red. And by declaration of code red, automatically also the national office should try to come in and try to help. Then they actually met the staff and made a rapid assessment of the damages and hospital needs. So they have to transfer the people on the top floor where the roof was damaged. So they have to move to the lower levels. They converted the office of the head of the office into an operation center so that it now becomes the center of command, control, and coordination. They discussed guidelines for operations such as reporting and daily updates on hospital activities. Next slide. They started recalling all personnel. So all personnel should report back to work. They gave multitasking of personnel. They started clearing electrical wiring and the cleaning of the areas. And the networking started together with the central office where I'm part of the DOH HEM central office, and together with the Center of Health Development, together with the Provincial Disaster Coordinating Council of Albay, and so forth.